And the latest and greatest procedure hitting Beverly Hills right now, it's the talk of the town. It's the vampire facelift.
It is the hottest new beauty trend in Hollywood, the vampire facelift.
Cosmetic medicine specialist performs a new procedure nicknamed the vampire facelift, using your own blood to make your face look years younger.
This was called the vampire facelift.
Called the vampire facelift because it uses your own blood to fill wrinkles. It lasts a good long time.
Now a handful of Austin doctors are riding the vampire facelift wave.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons.
One of the latest procedures, the so-called vampire facelift.
What is this, a purse?
What is the red one thing?
Oh, this red glitter is fabulous. It's from Dr. Nassif of Beverly Hills. It's the vampire facelift. This is the latest, greatest thing to hit Beverly Hills.
Oh, I gotta see what that.
Well, it's called the vampire facelift. Why? It's proving to keep many looking younger.
There is a procedure that can make you look years younger without the use of artificial fillers. It uses a patient's own blood. Alita Lopez has more on vampire facelifts.
Dr. Runnels saw beyond that and coined the designer procedure known as the vampire facelift. One of the world-leading plastic surgeons, Dr. Diamonds, is seeing a major boost in interest as soon as the photo of Kim tweeted out.
This week we have a lot of the procedures lined up, yes. We know plasma is very safe. It's your own blood being injected back in, basically, so it's 100% safe.
I think that initially people thought that it was kind of a gimmicky, sexy kind of procedure, but now it's caught on and really caught fire.
The vampire
The vampire
Vampire face.
Well, for people experiencing hair loss, there is a new treatment on the market. It is less invasive than hair transplant procedures and could someday become the gold standard. Eyewitness News anchor Ilona Carson takes a closer look at stem cell therapy.
The idea that this procedure could spark new hair growth has breathed new life into the race to clone hair, and that may be just the beginning.
Arlene Johnson has been losing hair for years now, and she's hoping to turn back the clock.
It was taking me like 20-30 minutes to comb my hair and with products to make it look like I had more hair, and that is aggravating.
Her weapon of choice, what could be the future of cosmetic treatments, stem cell therapy.
The vials that we're using are a combination of the plasma and the A cell.
Hair loss specialist Dr. Daniel McGrath is hoping to jumpstart the stem cells in Arlene's hair follicles.
Typically with female patients that have female pattern hair loss, thinning that they can't do anything about, and they get some thickening and regeneration of their hair. That's huge.
Here's how it works. A small amount of the patient's blood is taken, and the platelet-rich plasma is separated out. That is mixed with a wound-healing powder called A-cell and injected back into the scalp. Arlene's head has been numbed, so she doesn't feel a thing. Finally, the doctor uses some massage and small needles to create tiny wounds, which help trigger a healing response.
What sort of results have you been seeing?
The results we've seen thus far, not only in my practice but in colleagues that I'm close with across the country, has been better than 80% regrowth of hair or regeneration of hair across the board with our patients.
Check out these before and after pictures. This sort of therapy is being tested for a host of cosmetic uses, from plumping lips to firming sagging skin, even breast enhancement. As for Arlene,
I don't want to look 60 or 50 or 40. I just want to look as good as I can for my age.
So the big question, how much does this cost? About $3,500 for a treatment, but Arlene says it'll be money well spent if it works. We'll check back in about 6 months to see her results. Ilona Carson, 13 Eyewitness News.
energy and start living your life again. It can all be possible with the help of bioidentical hormone replacement. And with me this morning is George Thompson. He's with Total Med Solutions, and he brought along with him patient Jim Reynolds, who's here to share with us his story about bioidentical hormone therapy and how it improved his life. Gentlemen, good morning to you. George, always good to see you. I want you to remind our viewers exactly why people may need bioidentical hormone replacement.
Well, sure. Once you reach age 30, your testosterone levels start to decrease, and they'll decrease anywhere from 1 to 5% a year every single year thereafter. So we treat our patients with bioidentical hormone replacement, which is a natural testosterone from the soy plant, and it gives you energy, makes you feel 10, 20, 30 years younger, more mental focus, more clarity, sleep better at night. It just changes your life for the better.
Okay, so all of that information entices so many people to pick up the phone and call you like it did Jim. So you're currently a patient with Total Med Solutions. What's your story?
I came to Total Med Solutions about 6 months ago and was apprehensive at first.
Sure.
Didn't know exactly what to expect. But what I found in the beginning was a great organization that has a team that is just unbelievable. Dr. Ellen, so thorough, so caring, and the rest of the staff just so helpful. What I really experienced from the very get-go took about 2 to 3 weeks for it to begin, but was a new vitalization of energy. Just more energy than I had had in forever. Clarity of thinking. Total recall from conversations from 2 weeks ago to 2 years ago to 2 minutes ago to even what I had for dinner last night. And at 66, that is something that's kind of new for me at this time. As you age, these things slow down.
Yeah.
I also experienced weight loss. 40 pounds over about 4.5 months, and I wish that I could say I was very diligent and exercised and watched everything that I eat. I didn't. It just happened. The energy that your body is putting forth is being spent, the metabolism speeds up. I've just kind of continued on with what my lifestyle has began to be back 5 months ago, and it has just been phenomenal. Some of the other things that I've experienced is a whole new revitalization in practically every area. A lot of my friends have come to me and said, Jim, you know, I see a difference in you. And there is a difference. The thing that a lot of them have said is, how much does this cost? You know what, I can honestly look at them and say, you know what, it has not cost me anything. It has made me money.
Wow.
The energy, the strength, the stamina, the competence.
I mean, this is an unbelievable testimonial, George. I can see you brought, wow, I can see why you brought Jim. And obviously his story is like so many others that seek treatment. And this is very typical, isn't it?
It is. The people that I've talked to asked me, they said, you know, the cost, Jim, what about it? And I said, you know, I've been smoking for 40 years. In the last 3 weeks, I've cut down 90%. And when you're talking about smoking 2.5 packs a day for 40 years and the cost of cigarettes today, I've more than covered the cost just on the quitting smoking. My wife has also done the same.
Wow. Wow. I mean, that is a big deal. And obviously, not only is your overall health and wellness better, but you're kicking some really bad habits. And George, final thought on this.
Yeah. Well, you know, look, the fact of the matter is, when you have a program that can make you feel like you're 20 years old again, and the way that it works is real simple. We're bringing your levels back to where you were when you were 20. So that's why you have all the energy. That's why you can eat, drink, and do the things that you used to do when you're 20 years old and recover quicker. So that's changing people's lives.
It's changing people's lives, and I know you have a very special offer for GMT viewers. If they go to TotalMedSolutions.com/GMT and they fill out this quick questionnaire, they can they're getting a discount. Is
they get
right?
a $50 gift certificate.
$50 gift certificate towards changing their lives, like Jim. Really big deal. The number again is 214-987-9200. Gentlemen, thank you so much. Jim, thanks for sharing your story. And over to you, Carrie.
Well, now there's a new procedure injecting people's blood components into their face
Exactly right.
Tell us about this.
We've got a new wrinkle buster, and this was something that was presented at our big meeting back in October, the American Society of Plastic Surgeons. And what you do is exactly what you said, Travis. You draw the patient's own blood, you spin it, you separate the solid components, fibrin and platelets, from the other components. You take that fibrin and platelets and you inject it into wrinkles in your face, typically nasolabial line.
Like a self-filler, right?
And it is, and why that is, if you remember in your physiology and wound healing that platelets and fibrin form a matrix, and the collagen grows around that matrix. The other thing is that these products actually incite a growth factor release. So these would be the areas typically where we would want to inject these fillers. It's a little different. It's different than collagen. It's different than hyaluronic acid. But actually, they're getting pretty good results with it.
Are you using it yet?
I have not tried this yet. I mean,
Jim? Give it a shot.
You don't
Right
mean
here.
personally on my face. No, not yet.
I was just trying to get a sense for how common this is across
But it's
the
similar.
country
When
right
we
now.
take fat, we spin it to separate it, make
How
sure.
long does it last? Does it get a reaction, or does it actually last?
Well, you get about a year. So again, it's not permanent.
Those other fillers aren't permanent either, right?
No, right.
Well, and it may be a good thing it's not permanent because what if you don't like it?
So, same deal that you want to inject these intradermally, and what they're doing, that they will stimulate a growth of your own collagen. That's the idea, creating a matrix. Good stuff, interesting idea out of Manhattan Eye and Ear, my old stomping
I think
grounds.
that this type of therapy is going to become more and more common for a whole host of problems because you're using your own body's components
tissue.
to
You're not using synthesized manufactured products. Let's take a look and see how this works. These were done by Dr. Sclafani. He was nice enough to share these with us, but you can see the improvement, the filling of the nasolabial lines, corner of mouth. Wow. Early results. The great thing is, all natural. It's all you, baby.
Don't do it at home.
No.
I don't want people
Don't do it in your garage.
There's definitely an art to all of these fillers and things, right?
Yes.
No. We said Kelty Colleen.
Here we go. It doesn't hurt. That was my first vial. I felt it. First the fangs, the needle, and then fast, arm up, so I don't faint. Secretly, I didn't want to tell the doctor because I wanted to act like I was really courageous, but I almost passed out for sure.
You okay now? You want to tilt you back a bit?
No, I'm
It
good.
does help.
I'm good.
Okay.
Dr. Ackerman of Newport Beach spins my blood to make the vampire serum. In MedSpeak, it's platelet-rich plasma.
PRP is a wonderful thing. It's been around for a bit, been used in various indications. Now we use it to make people look more beautiful.
The blood is coming. Kim's always colorful, but the blood is actually clear for the true vampire facelift.
Now, in your particular case, we're treating very small area, little hollowness right through there.
Okay.
So you don't need that much. Same thing on this side. You ready?
Yep.
Just for a second.
One drop, one injection, and an almost instant lift. Do I have fangs now? So I know what you guys were thinking. Did it hurt? And to be honest, little pinpricks. It was doable.
Actually, I was thinking, what about steam and moisturizer? What happened to the good old days?
No, that had to hurt. Come on, Kelty. Great stuff. And next time we find something insane to do, we will send you again.
The latest anti-aging efforts don't involve surgery or extensive downtime. New youthful options for women are available that use only a shot to bring feelings of heightened well-being and reviving the feelings of intimacy. I'm talking about the O-Shot, and joining me to discuss this approach is the inventor, Dr. Charles Runnels, along with Brenda Skaggs, a nurse with the Artemis Medical Group that offers the O-Shot here in Columbus. Welcome to both of you.
Thank you.
Doctor, it's a pleasure to have you here, traveling in from, Alabama, where you're from.
Thank you.
The O-Shot is your invention.
Yes.
How would you describe it?
First of all, thank you for having the courage to talk about this.
Well, it is important, and I know there's women out there who have issues.
And it's difficult to talk about it. Even though somewhere around 40% of women have difficulty with their sexuality, only 14% of them ever have a conversation with their doctor. And so thank you for having the courage to bring it out. It's such a huge problem.
So how does the O-Shot help these folks?
Well, there are 4 major problems that women suffer with, either pain with intercourse, or trouble with arousal or sex drive, or trouble with having an orgasm. You know, Emerson called sex and beauty the scaffolding of love. So even though a relationship can develop where it's not as important, it's so important. You know, as an example, I had a woman who lives close to me who delivered a 10-pound baby. And in her 20s, now all of a sudden she has pain with intercourse. She has urinary incontinence. She's trying to maintain a relationship with her husband. And that, it makes her feel unlovable and started to interfere with her marriage, just as one example. And within a month of this, having this shot, she's back to having comfortable relations with her husband again.
This just isn't a regular shot, though. This is a shot involving part of the person themselves, which is a little difficult for some people to understand how that works.
Yes. Thank you for bringing that up, because there is no foreign body injected. There's no surgery. It's just an injection. But I didn't invent the technology. This has been used for many years by the NFL. They'll draw blood from an athlete and inject it into the knee to help rejuvenate the knee. Basically, the way to think about it, we're creating that yellow goo. Remember when you scuffed your knee as a child and there's a scab there and there's this yellow goo there? That yellow goo is what caused the skin to regrow. And there's a way to make that in about 10 minutes by drawing your blood and activating it with a little calcium. Now the blood thinks you have an injury, and wherever you put that, it rejuvenates the tissue. For at least the past 10 years, oral surgeons have used it, orthopedic surgeons have used it.
So while it's not new in this regard for women, that's what's new.
The new idea was, actually, I invented a way of regenerating the face called the vampire facelift. And the way the whole shot came about was I was treating a woman who loved it so much, she asked me, would you put this in my vagina, because I've delivered 3 children, to see if it makes things feel better. And when I did, so a woman helped think of it, and when I did, the results were so astounding, I started inviting women who I knew that had difficulties to try the procedure, and the results just continued so much. Now we have over 100 doctors doing it, and one of the lead injectors and educators are here in Columbus at the Artemis Center, where they're helping us gather research. We're ready to publish some research about it, demonstrating over 90% efficacy, and urinary incontinence as well, because that whole tissue, the tissue between the vagina and the urethra is only 1/4 of an inch. So in an 18-year-old, and even 20-something-year-olds, about 1 in 20 of them have urinary incontinence that interferes. So this helps.
Brenda, what are the reaction of your clients?
Yeah. So far, we're having a great turnout with everybody. All our patients are very, very happy. This week, I just saw one of the patients back. It's been a year since her first injection, and she was on hormone replacement therapy at that time. She's been completely off of it and still having great results at a year.
Well, last question, doctor. I have to ask, because we're talking about a shot in sensitive areas. Is it painful?
It's not. We use a numbing cream that's very strong, and by the time it's absorbed, surprisingly, there's almost no pain. And most people have 0 pain, but at the worst, they'll have something that's similar to a regular injection.
This is very interesting. Before we go, real quick, we have a couple before and after pictures, and I just wanted to show one of them because that's the other...
The vampire facelift, yes, which actually promoted the thinking of this.
And especially around the eyes, I noticed this. And this is another thing that's available at Artemis as well, correct, Brenda? Yes. So folks can come in and ask for both. And it's a pleasure to meet you. Interesting.
I was honored to be on the show. Thank you.
Thank you. And Brenda, pleasure to meet you as well. Thanks.
And the latest and greatest procedure hitting Beverly Hills right now, it's the talk of the town. It's the vampire facelift.
It is the hottest new beauty trend.